If you're living with multiple myeloma, you know that your immune system is often compromised. That means you're more susceptible to infections, and one we need to talk about is measles. With recent outbreaks in some areas and the critical decline in herd immunity, and it is a critical decline now, it is vital to understand how to protect yourself, or if you are a caregiver, your loved one. In this video, we'll cover everything you need to know about preventing measles as a myeloma patient. But first, let's have a little review of how infectious diseases can impact myeloma patients. With many diseases, the cause of death is so often not the disease itself, but the impairments, compromise, and complications that the disease causes. For example, my father died of Parkinson's disease, but not clinically. He died of aspiration pneumonia, which is a common complication caused by what the Parkinson's did to the muscles that controlled his ability to swallow. With multiple myeloma, the leading cause of death of us patients with myeloma, is infection. And this is because myeloma compromises our immune systems, leaving most of us slow to produce enough of the antibodies we need in the amount that we need. And overall, there are some studies that say that myeloma patients have a 7-fold increased risk of death of bacterial infections and a 10-fold increased risk when it comes to viral ones. So what does this mean when it comes to measles? Well, to stop transmission of measles in general, there needs to be a vaccine rate of about 95%. And due to misinformation and vaccine hesitancy, there has been a 30% year-over-year increase in the cases of measles that continues as I make this video. I mean, here in the middle of March of 2025, there are already more cases in the US than there were all of last year, and we're only 3 months into the year. Measles is a highly contagious viral infection with a 90% attack rate in those lacking immunity, and it can cause serious complications, especially for people with weakened immune systems. For myeloma patients, getting measles can lead to severe pneumonia, encephalitis, which is brain swelling, and even death. Because your body is not able to mount a strong immune response, prevention is key. Or, as I say, don't fear measles, manage your risk. Well, managing your risk does depend a bit on your age and where you are and where you've been with your treatment. Let's start with your age. Myeloma patients born in 1957 and before were noted to have robust measles antibodies in their blood when it was most closely looked at in 2015, which was when there was last a big jump in measles cases. Not like what we've seen today, but that was the last notable jump. However, there are many myeloma patients now who were born after 1957, and our measles antibodies have not been examined nearly as well. So the first thing you can do is look up your vaccination records and ask your doctor to check your antibody titers. Now, chances are, if you're a myeloma patient, you're having your blood drawn on a somewhat regular basis. It's easy to ask your doctor to just throw in another test for your titers. The most effective way to prevent measles is the MMR vaccine, which protects against measles, mumps, and rubella. However, MMR is an old-school live vaccine, meaning a person getting it receives a small bit of live virus. And live viruses are generally not recommended for myeloma patients currently undergoing active treatment. That's because your weakened immune system might not be able to handle the live virus potentially, and it could lead to infection. Even just taking something as much as a little bit of steroid can compromise your immunity beyond where it would be safe to give you the vaccine. Now, if you've had a stem cell transplant or CAR T in the not-so-distant past and have gone through all your revaccinations, you may be in the best position of all the myeloma patients. Always, and I mean always, talk to your hematologist or oncologist to evaluate your position before getting any vaccine, not just MMR. They can assess your individual risk, and they know the status of your lymph and all your immunoglobulins and your good old absolute neutrophil count. And then they can determine the safest course of action and figure out the best time in your treatment or your maintenance schedule to get it. In myeloma patients who have received MMR vaccines, well, there's a bit of a question about who may mount the best response to the vaccine. We're diving into the deep sea of fishes here, where the genomic profile of your particular strain of myeloma may be at play. Now, if you remember the fish study that was done when you had your bone marrow biopsy done when you were diagnosed, that's what we're talking about here. There's been some writing about a patient named Stacy Earholtz who in 2015 mounted a fantastic response to the measles vaccine that was given to her at the Mayo Clinic. But other patients did not have the same or similar response, and it wound up leading to a study that indicated that patients with higher levels of CD46 do better than others. See, it's complicated. But what's not complicated is what you can do. Even if you can't get vaccinated, there are other ways to protect yourself. Absolutely stay away from anyone who has measles or shows symptoms like fever, rash, or cough. Practice good hand hygiene. Wash your hands frequently with soap and water and avoid touching your face. During outbreaks, consider wearing a well-fitted mask in public places, especially in crowded places like hospitals or clinics where all the sick people are. Make sure your family members and caregivers are vaccinated. This helps create a herd immunity bubble around you. If you have anti-vaxxers or vaccine hesitancy in your family, you have to have the conversation. If you've been exposed to measles, your doctor might recommend post-exposure prophylaxis. This can include immunoglobulins like IVIG, something like that. And this provides you a temporary passive immunity by giving you the antibodies to fight the virus. In a few cases, if you are not severely immunocompromised and you are in a very good state in regards to your myeloma, the vaccine can be given within 72 hours of exposure to help prevent illness. But in any and all cases, contact your oncologist or myeloma specialist immediately if you think you've been exposed. Time is of the essence, and this is not a matter for your general practitioner or primary care physician. It's important to know the symptoms of measles, just so you can identify sick people around you or seek medical attention quickly if you need it. High fever, usually over 104 degrees. Cough, runny nose, and red watery eyes. These are often the first signs. Koplik spots, tiny white spots with bluish white centers found inside the mouth. Rash, a red or reddish brown rash that starts at the face and spreads down the body. So, to summarize, don't fear the measles, but do manage the risks. Consult your doctor about MMR vaccinations. Get your titers checked. Practice good hygiene and avoid contact with infected individuals, which is a good practice all the time anyway. Ensure your household, your loved ones, your friends are vaccinated for measles, and seek immediate medical attention if you suspect exposure or experience any symptoms. Protecting yourself from measles was not something any cancer patient had to think about before, but it is crucial for your health, and having a plan is great for your peace of mind. If you have any questions, please leave them in the comments below, and don't forget to like this video and subscribe for more information on living with multiple myeloma. I'll see you next time.